Hi, I'm Mackenzie, and this is Dr. Scott Christie, and welcome to our first episode of Cheer District's Injury Prevention Series. So, Scott, tell me, what are the most common injuries we tend to see in cheerleading?
Well, I think before we can actually talk about what the common injuries are, we should actually discuss the separation in injuries based on age group. So when we're looking at cheerleading, the research tends to show the research being separated by 11 years and under and then 12 years and up. And 11 years and under, you're looking at the injuries being a little bit more catastrophic, meaning that you're going to look at dislocations or fractures. And then in the older age group, the 12 and up, you're looking more at the sprains and strains. Based on that information, it kind of tells us a little bit of a different story. But if you look at the overall picture, you're kind of looking at the injuries in cheerleading are pretty equally distributed amongst lower body, upper body, and then we also have head and neck. There's maybe a little bit of different percentages depending on the research you look, but they're usually pretty much equally distributed amongst all of them.
Okay, so specifically, let's start with the lower body. What are the most common injuries we see there?
So basically, if you're going in the 12 years and up, you're looking at sprains and strains. So what I'll typically see, and in the research shows this, but in my practice as well, you'll see ankle sprains, and the common ankle sprains will be going over on the ankle. You might see sprains of the inside of the knee. Those are kind of going to be the two biggest ones that I see. In the younger age group, you're kind of looking at fractures in the lower limb. So they might break the tibia, or they might have an avulsion fracture, meaning that some of the bone is actually being pulled with the tendon. Those are generally the most common injuries in the lower body for cheerleading.
And why is that for specifically the lower age group?
So the lower age group becomes, if you take a look at the psychology of what their thought process is, they don't have as much fear when you're younger. And so they will tend to be pushed a little bit more than they should because you're excited about trying to learn more things and the technique isn't quite good enough. And so one arm will collapse on them because they're a little bit tired, or maybe they shouldn't be quite doing that skill just yet. It would be hard to say, but that's generally what the research tends to point to, is that they're doing things that maybe they're not quite ready for.
So we've talked about the common injuries we see in the lower body. What can we do to prevent those injuries from happening?
I think, so if we're looking at just the athlete here, the responsibility is going to be typically 4 areas, and then there's going to be a larger area that we'll take a look at as well. But the 4 areas are going to be what we would call stability, mobility, strength, and then power. And then amongst those, you're looking at differences or imbalances between the two, trying to make sure you don't have that. So when we're talking about stability, I'm just referring to trying to do balance work in a stationary position and in a moving position. When I'm talking about mobility, once again, now your whole body would be moving side to side, not while your foot is stationary, but your foot will move around with you. Strength is obvious, you're just trying to build up the strength around the ankle muscles. And then power would be you're trying to incorporate as much strength as you can with the power or speed of contraction, because that's really a lot of what cheerleading and tumbling within cheerleading is all about, is explosive movements. So you have to make sure we're moving towards that direction of building out power. And I think one other point that I don't want to miss is going to be, once you develop the strength and once you develop the power, you need to have endurance of strength and endurance of power. So one of the components here is that we want to actually strengthen the ankle joint. You want to make sure you're strengthening the ankle joint in just about every position that is possible. And I realize we're probably doing these things at home. So what we're going to use is a little band that's a loop. So it's actually all connected. And then we're going to go through 3 different ankle positions. The first one's going to be, you want to put this loop around just close to the toes of the feet. The simplest thing probably here is going to be to straighten your knees so that just your heels are on the floor. You're going to take a little bit wider stance and then let the sole of your shoes kind of face each other. We're going to try and work the muscles that go up on the outside of the leg here. So your job's going to be is to actually take your feet now and curl them out so that you're just moving out the ankle joint. When it comes to sets and reps, it's a longer story, but we're typically looking at anywhere from 4 all the way up to maybe 15 repetitions to try and increase strength here. All of this is done in the Cheer District training app, but if you're just going to kind of rehab the ankles on your own time so that you hopefully reduce further risk of injury, this is what we're looking at to work the muscles on the outside. So now what we want to do is do the opposite motion. So if you just cross one leg over the other, You don't even have to take the band off. Okay, so you're kind of in a bit of a figure 4 position. Now we want to work the muscles that come on the inside of the ankle here, and you're going to curl the foot up towards me. So, and you can kind of feel that pulling up in through the calf area. Same thing, everything's going to be kind of the same. You want to make sure you're doing the same amount of reps in each one of these positions. So now we've taken care of the outside, we've taken care of the inside. Now we want to do pretty much the front of the shin, so you'll slide back. You can just put your heel up on the chair or step that you're on. Now you're going to let your toe go down and you're going to pull it back up again. Okay, so here what we've done is we've actually done 3 different positions. The last one, what we're going to do is you're actually going to have to stand up. Okay, you might as well just go on here and I'll kind of hold on to you just to give people, so you can take the band off. Okay, what we're going to do is work the calves here, so you can take that band right off. I'll take that from you. Turn and face that way. And then just hold on to me. So if you're at home, you would just use one of your stairs, so just slide your heels back a little bit, and then you're just going to let your heels drop down, and then you bring your heels all the way back up again, and then back down. Now, trying to do this one-legged can be difficult, so I would just suggest to start with 2. When you're stronger, you can do one-legged. Now we've actually done every part of the muscles that surround the ankle joint.
Okay, so now we're going to talk about stability. What can you tell us about stability?
There's actually quite a bit that we can do for stability, and we'll start with simple first. What I'm going to get you to do is just stand on one leg. I want you to go into a lid position or a torch position. Okay, let's put the hands on the hips for now so that we're consistent. This is all I'm going to ask you to do, and I want you to be able to do that for 30 seconds.
Okay.
Once you get good at that, then I want you to actually try doing this with your eyes closed. And you can see it becomes quite a bit more difficult. And what I would really like to see is that everybody should be able to do this with their eyes closed for 30 seconds on each leg, because we talked about making sure you're not having imbalances. So let's see you do the other side with the eyes open.
Okay, I'm not a flyer for this reason. No.
Okay. So when you're watching this, you can see some of these things are pretty difficult. Now try the eyes closed. Okay, much better. So we're going to move into other components here of balance or stability, and everything we do, you can do eyes open, and if you're really good at it, you can do eyes closed. There's also another little trick that you can do as well. If you go back into that lip position again, if you just try and turn your head all the way to the left, and you turn your head all the way to the right. Okay, come back and then bring your head down, and then bring your head up. So we're kind of playing around with a bunch of different things. One's called your vestibular system, which is basically just fluid in the inner ear. Then we've also got vision, and then your proprioception, which is just your muscles that are used to balance, the muscles that we work on around the ankle joint. So that's what we call static balance, with a whole bunch of different challenges. Once again, all of this kind of stuff is built into the Cheer District Training app. Now to move on, we want to make this what we would call a still static or stationary, but you start moving around with your foot in one position. So if you stand on one leg, choose which one you want to try first.
Oh gosh.
Okay, what I want you to do is you're going to reach as far as you can forward while you're bending the leg you're on. It's almost like you're trying to slide something along the floor, but you're not touching the floor. Come back up. And you don't even need to go that low depending on how hard that is. Then I want you to reach to the back. And then come back up and try not to put your foot down. Now come back across this way towards me as far as you can, and then come back up. And the goal here is going to be to try to keep your foot as still as possible, so you're fighting not to let it wobble. You actually purposely have to try to be as still as you can. Once again, once that's easy, you can do it eyes closed, or you can do it while you're trying to move your head in all kinds of different directions. The last one, which is we're going to call dynamic balance, is going to be you actually doing a hop. So let's just start with something simple first. So you go into the lip position, and I just want you to hop straight up, and then come back down and stick your landing. And then back up, and stick your landing. Once again, you'll do both sides, but now let's make this a little bit more difficult. So you're going to go side to side. So when you go to the side, you stick your landing. And then stick it. Yeah, try not to have any foot movement. Yes. And then come back towards me. So this gets a little bit more advanced, as you can see. Back the other way. And to me, this would probably be, this is where we're trying to head with the balancing. This is what I'm going to say is really important for cheerleading, is that you need to be able to control your ankle joint when you start introducing movement. And again, you can actually go into having your eyes closed to do these things. You can also play around with going in different directions. So you don't just have to go side to side, you can go front, back, or on diagonals.
Okay, so now we're going to talk a little bit more about flexibility. What can you tell us about how to increase our flexibility?
So I think one of the things I want to do first is just check to see if there's a difference between two sides, because as we talked about, one of the common ways to reduce your risk of injury is to make sure you have balance between both sides, and it won't be any different for flexibility. Now, the research isn't as strong here, but there's still some research to indicate that if you have imbalances in flexibility, that may increase your risk of injury. So for at home, just a simple little test, because there's many different ways to test ankle flexibility. We're just going to test one way, because I find in cheerleading, this is the one that I'll see the most often. So all you're going to do is you can have a friend with you. You're going to make sure that your knee's over your toe. You're going to keep your heel down, and then I just want you, you're in a lunge position already. I just want you to push that knee over your toe as far as you can, keeping the heel down. Okay, so that's as far as you can go. You'll take something that's fairly straight. You'll go up and down from here. Then you're going to measure the distance from the front of your toe to where this stick lands. And then we do both sides, and we look to see if there's a difference. Okay, and so in your case, without doing an exact measurement, I would definitely say your right ankle flexibility is greater than your left. So we would want to work on that. So the question is, how do we do that? Well, it's actually just doing this movement. And there's a whole bunch of different ways to do this, but for now it's just going to be, let's go back to the other foot. And you can set this up on a step, or you can do it on the floor. I just want you to rock into the movement, keeping your heel down, and then come back out of there, and you just go back in and out of that 10 times. And being in this position just ensures that we work on the ankle joint. Okay. I think one of maybe the most underworked areas in cheerleading is going to be to develop power. So this is a favorite section of mine. Other names for this might be plyometrics. I think people are familiar with that terminology. So what we're going to do here is let's just start with your feet together, because in cheerleading, when you guys are coming out of a round off, or when you're actually going to do toe touches or herky jumps, a lot of your jumps are done with your feet together. And if we look at something called the principle of specificity, you only develop strength or power in the positions that you train in. And same thing in the movement patterns and at the speed that you train at. So when we're looking at developing programs, once again, this is put into the Cheer District Training app, you want to make sure that we're being fairly specific to the sport that you're training. So this is where we're moving into cheerleading specific activity. So here all I want you to do is you're just going to do a little bit of a counter movement first, but then after that I want you to be fairly stiff at the knees and do most of your punching at the ankle joints. Okay? So let's just do a few first. So even stiffer, don't bend the knees that much. There you go. Okay, so now let's just stop for a second. So you kind of got the idea there. So we want to be stiffer at the knees so the knees don't bounce very much, and I want you to do most of the movement through the ankle. The last point here is going to be, and this should be for even if you're doing strength training, I want you to do maximum intensity, meaning try as hard as you can. Okay, so let's just try that again. So just a little jump to start with, and then punch through the toes. There, as high as you can, as high as you can. Okay, good. So now what we'll do is, let's just stick with 2 feet. You can actually start just taking a little bit of a wider stance, and then you can play around with the different widths, but we would just do the same thing. So start with a little jump, hands are on the hips, and then punch, 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 punch. Good. And then as long as you're trying as hard as you can, that's what's going to be important. The reps and the sets is something we'll have to talk about in a different episode, because one of my favorite topics is fatigue. And I really would want to get into that, is to determine how many sets and reps you're doing if you want to get the best out of your strength and the best out of your power. Now next we discussed that another way to increase your risk of injury is to have the imbalances. So it's no different here in power than it is with strength or flexibility. Here what I want you to do is we're going to do single leg. Okay, so let's go whatever leg you want to choose first. I want the hands on the hips. This is no different than what we were doing before, a little bit of a squat first, and then punch, punch, faster, higher, faster, higher. Okay, good. And And now you can kind of see in the video here, she's moving around a little bit. What we would tend to focus on is maybe put a little circle on the floor so that you're kind of hitting one spot. And then to make it more difficult, we can start to put different circles down, but you're always going to be jumping as high and as fast as you can as you move through those circles. And that's basically how we develop power through the ankle joint. We'll have to talk about the knees and the hip a little bit more afterwards.
Okay, so today we talked about a lot of common injuries found in the lower body and 4 ways we can help prevent them with power, strength, mobility, and stability. Next week we're going to talk about
Severus disease. So with Severus disease, right now we put a lot of attention on probably trying to avoid sprains and strains. And that's typically in the 12-year-old and up. But another condition that we see a lot, and I see it a lot in my clinic just this week, I think we were talking about, I've seen 3 or 4 cases of this. And I want to talk about, we're not really going to talk about how to treat the injury, but we're going to talk about how to avoid it so that these younger kids don't have this, because it hurts quite a bit. And we'll get into more about what it is, but it really has to do with the growth plate on the heel of the foot. And we'll go over a few things on maybe how to avoid it. And if you have it, maybe just some things you can do in the meantime to try and keep the pain down. But typically you should go see your therapist to get it treated if you have it. But our goal is going to be to try to make sure you don't get it in the first place.
Awesome. Okay, see you next week.